In this lecture, we will be looking at hypertension, which is high blood pressure. Before we look at hypertension, let's first look at what the factors affecting blood pressure are. Blood pressure is affected by three things. Cardiac output. This is the volume of blood pumped out by the heart per unit time. If cardiac output increases, blood pressure would also increase. Blood volume is how much blood there is in the body. The more blood there is, the higher the blood pressure will be. If there is increased resistance towards blood flow, that will also increase the blood pressure. So, what affects resistance? Firstly, the flexibility of the artery walls. Healthy arteries are elastic. During systole, when the heart pumps blood out at a high pressure, an elastic artery can expand and absorb the shock of the high pressure. Secondly, artery diameter. If there is vasoconstriction and arteries are narrow, that increases the resistance to blood flow and blood pressure would increase. Thirdly, blood viscosity, which is how thick the blood is. Increased blood viscosity will increase resistance to blood flow. A normal blood pressure is less than 120 millimeters of mercury during systole, which is when the heart contracts, and less than 80 millimeters of mercury during diastole, which is when the heart relaxes. So, what is considered as high blood pressure? Traditionally, a blood pressure of more than 140 over 90 millimeters of mercury is considered high. But recently, in 2017, the American Heart Association and American College of Cardiology recommended that a blood pressure of 130 over 80 millimeters mercury should be considered as hypertension. With the previous definition, 1/3 of US adults would have high blood pressure, but with these new stricter guidelines, nearly half of the US adult population would be considered to have hypertension. The rationale for this stricter definition was to diagnose hypertension early so that people can make lifestyle changes to address the problem at an earlier stage. However, not everyone has accepted the recommendations for the stricter cutoff point for hypertension. In Singapore, hypertension is still currently defined as a blood pressure exceeding 140 over 90 millimeters mercury. Hypertension is defined as a condition of persistent high arteriosystolic and/or diastolic blood pressure at rest. So, if both systolic and diastolic pressure are high, obviously that will be considered as hypertension. What if, let's say, only the systolic blood pressure is high, but the diastolic blood pressure is normal? That would still be considered as hypertension. Another keyword here is persistent high blood pressure. So, to diagnose hypertension, at least 2 blood pressure readings should be taken on separate occasions. Hypertension usually does not result in any symptoms. Some people may report giddiness or headache if their blood pressure is very high, but this is not very common. Fortunately, it's not that hard to detect hypertension, just measure the blood pressure. It is important for hypertension to be detected early because uncontrolled hypertension can eventually cause damage to other organs in the body, such as the heart, kidneys, eyes, and brain. Let's look at the types of hypertension. The most common type of hypertension is primary hypertension or essential hypertension. There is no one direct cause for primary hypertension. Rather, there are many different risk factors that contribute to it. For example, smoking, obesity, hyperlipidemia, and diabetes. Another type of hypertension is secondary hypertension. The hypertension is secondary to a disease, which means the hypertension is directly caused by another disease. I'll just give some examples. For example, maybe a person has a brain tumor, which causes the pituitary gland to secrete ACTH, which then signals for the release of excess aldosterone. So aldosterone causes salt and water retention, which will then increase the blood volume and cause hypertension. Or another example, maybe a person has kidney failure. If the kidneys are unable to excrete excess water, then the blood volume will increase, which causes hypertension. Or let's say someone has a disease of the adrenal glands and is overproducing the hormones epinephrine and norepinephrine. That will also increase the blood pressure. Some pregnant ladies have gestational hypertension. They have high blood pressure during the later half of the pregnancy, but it goes away after the baby is delivered. As mentioned earlier, primary hypertension does not have a direct cause, but there are several risk factors, including smoking, diabetes, hyperlipidemia or high cholesterol, and obesity. Now let's look at the pathophysiology of hypertension. Blood pressure is the product of cardiac output and total peripheral resistance. So it makes sense that the pathogenic mechanisms of hypertension must involve increased cardiac output, increased total peripheral resistance, or both. The pathophysiologic mechanisms of hypertension are still not fully understood. There are many interrelated factors involved. Let's just look at 3 of the most well-studied mechanisms. The first possible mechanism is activation of the sympathetic nervous system. Activation of the sympathetic nervous system means the fight or flight response is activated. So the heart rate increases. In general, there is vasoconstriction, and so both of these effects will increase the blood pressure. Another important mechanism is the activation of the renin-angiotensin-aldosterone system, or RAAS. You should have learned about the RAAS in your Year 1 Physiology module, but here's a recap. Angiotensinogen is a plasma protein produced by the liver. In response to certain stimuli, the kidneys secrete an enzyme called renin. Renin converts angiotensinogen to angiotensin 1. At the lungs, angiotensin 1 is converted by the angiotensin converting enzyme into angiotensin 2. Angiotensin 2 causes vasoconstriction, and it also stimulates the adrenal gland to produce aldosterone. Aldosterone increases the reabsorption of sodium and water at the kidneys, which increases the blood volume. So, when the RAAS is inappropriately activated, the vasoconstriction caused by angiotensin 2 and the retention of sodium and water caused by aldosterone would cause hypertension. Another pathophysiologic mechanism is arterial stiffness, and this is more common among the elderly. Arterial stiffness can lead to isolated systolic hypertension, where the systolic blood pressure is high, but the diastolic blood pressure is normal or even low. Let's look at how it works. In a young healthy individual, the arteries are elastic. So during systole, the heart pumps blood out at high pressure. The large arteries would then expand and absorb some of the pressure. During diastole, where the heart is relaxed, the arteries that have expanded will then recoil and push the blood forward. In aging, the arteries become more stiff. So during systole, the stiff arteries will not be able to expand to absorb some of the pressure. This results in a high systolic blood pressure. During diastole, there is also no elastic recoil to help push the blood forward, so the diastolic blood pressure would usually be low. If hypertension is not controlled, over time it can cause many complications. Hypertension is a risk factor for coronary heart disease. The high blood pressure can damage the artery walls, making them more vulnerable to plaque buildup. This can then lead to angina and myocardial infarction. Hypertension can also lead to left ventricular hypertrophy. Hypertrophy means enlargement due to increase in the size of the cells. Since blood pressure is high, it means the heart has to pump out blood against an increased pressure. Since the left ventricle has to pump blood to the different parts of the body, the left ventricle will be affected since it has to work harder. In order to work harder, the cardiac muscle fibers become enlarged. In the long run, this is not a good thing. The enlarged muscle fibers will need more oxygen. With this increased demand for oxygen, there is a higher chance that the supply of oxygen may not meet the demand, and this will cause the heart muscles to die. Eventually, this can lead to heart failure. In fact, hypertension contributes to about 70% of congestive heart failure cases. Hypertension can also lead to stroke. There are two kinds of stroke, ischemic and hemorrhagic stroke. Ischemic stroke occurs when a cerebral artery is blocked, usually by a blood clot. Hemorrhagic stroke occurs when a blood vessel in the brain bursts, which causes bleeding in the brain. Both types of stroke can be caused by hypertension. Hypertension damages the blood vessels. It could damage the blood vessels in the kidneys, affecting their ability to filter blood effectively. It could also damage the blood vessels in the retina, which can lead to loss of vision. There are many medications available for the treatment of hypertension. So if one drug is not sufficient to bring the patient's blood pressure down to the target levels, a combination of drugs can be used. The different classes of antihypertensive medications will reduce blood pressure by different mechanisms. Diuretics help to remove excess water in the body by increasing the production of urine. Beta blockers block the effect of epinephrine and causes the heart to beat more slowly and with less force. ACE inhibitors and angiotensin II receptor blockers block the activation of the renin-angiotensin-aldosterone system. Arterial vasodilators and calcium channel blockers can cause vasodilation. Besides medication, lifestyle modifications are also important to help control hypertension. Regular exercise is important. A good amount of exercise would be at least 30 minutes of exercise 5 to 7 days a week. For those who are overweight, losing weight can also help to reduce blood pressure. Smoking increases blood pressure due to its nicotine content, so quitting smoking can help to lower blood pressure and also reduce the risk of heart disease. Reducing salt in the diet also helps to lower blood pressure. Alcohol consumption should also be limited to at most 2 drinks per day for men and 1 drink per day for women. A healthy, low-fat, high-fiber diet can also help to reduce blood pressure. The DASH diet is a diet that has been well studied for hypertension. Okay, so in this lecture, we have looked at the definition of hypertension. Although there have been some recommendations for a lower cutoff point, for now we will still use the definition of blood pressure equals to or exceeding 140/90 millimeters mercury as high blood pressure. We have also seen that there are 3 types of hypertension: primary, secondary, and gestational hypertension. For primary hypertension, we have covered the risk factors and pathophysiology. We've also looked at the complications of hypertension, and finally we have gone through the treatments available and recommended lifestyle management strategies for hypertension.